with kids and their eye health, I think it's really important from a developmental standpoint. So if a kid's eyes aren't doing what they need to, they're going to potentially struggle in school, potentially struggle reading. It's really important if we can see those kids, and if there is an eye problem, that we get it identified and treated as quickly as we can. So obviously with Children's Eye Health Month, it's extremely important just because there are still a lot of kids that aren't getting seen, that aren't getting the treatment that they need. And so we've done a very good job, especially in the US in the last 10 years, of identifying kids. And some of the vision screenings that we're doing has been really, really helpful in getting these kids who probably wouldn't have been seen otherwise, getting seen earlier, but there's still a lot of work to do. So fortunately, vision problems are not that common amongst children, although if they are there, we do have to get on top of it relatively quickly. So the most common time that we probably see these are especially when kids are starting into school age. And one of the things that is very important to us is that these vision problems can sometimes be permanent if we don't get to them by a certain age. And we think that that age is usually between 6 and 8 years old. A child's neurologic development is still progressing. And especially within the visual system, it gets locked in kind of at about 6, 7, 8 years old. And so if we can identify problems before then we can have a chance to try and prevent some of these problems. So ideally, I recommend seeing kids at about 4 or 5 years old.